My remit was to talk about the role of guidelines in furthering the agenda of personalized medicine. Um, so I covered areas um, such as initially what the work of the guidelines are, the scope and the reach of the guidelines, um, but also reflecting on the fact that despite them being so widely used globally, with 64 countries now endorsing the guidelines, including all 28 EU member states, that there is still great problems with effective implementation of the recommendations. So you find that in some countries, adherence to high quality guideline recommendations that are underpinned by good evidence is very high. But then in another EU country, you'll find adherence rates would be very low. But that has consequences, meaning that outcomes for patients are affected. They'll be poorer. But even worse, we have evidence to show that in about 25% of cases that actually patients get potentially harmful treatment. And you combine all of that, the costs to society and to the economy is huge. And so in our drive for personalized medicine, improving it, we all think of innovations. And I suppose my point was that's great, and we should always innovate. But actually, maybe we should pause for a moment and look at how we implement the knowledge we already have, which is not good. No, across certainly across urology, in terms of the various disease areas, and as you know, we cover from the kidneys, bladder, prostate, testicles, and things like that, all of the waterworks. And so we have guidelines that are pretty comprehensive, covering all of the major diseases that affect these organs. And as I say, very widely distributed, disseminated, and they're updated every year to account for new evidence that comes in. So it's quite an onerous task, but also a task that is costly. Costs the EAU millions of euro to update these guidelines every year. And so it's heartbreaking when you have good quality recommendations that are not being adhered to by health professionals, right? Which means that patients are not receiving the care they could be receiving. Well, that's the $64 million question, right? And it is clearly multifactorial, the reasons, in terms of, yes, some surgeons or hospitals or healthcare providers may not be aware of the guidelines, right? Even though they're widely distributed, there are times when people are just not aware of its existence. So the first issue is more effective dissemination. So it has to be optimized. Yes, we disseminate pretty well, but we can do more. And we've taken guideline recommendations now to social media. The EAU guidelines has a hashtag on Twitter, and so we are doing our best to reach different communities in different ways. That's the first thing. But then we do recognize that actually just disseminating and getting people to have the information in front of them is not enough, right? We do know that just because you have the guideline available doesn't mean, firstly, that you read it, and secondly, even if you were to read it, doesn't mean you follow it, right? And even if you follow it, it doesn't mean you follow it in the right way, right? So the understanding of the recommendation and your actual implementation of the meaning of that recommendation may be misunderstood. So, of course, there are a number of areas that one must address. But to come back to the point of your question, how do we get people to adhere to them? Changing behavior of any human being is incredibly difficult. And so surgeons or health professionals are no different. But we must find ways, methods, tactically, to try and translate that knowledge in a way that people find it acceptable, firstly, i.e. health professionals, but also demonstrate to them the benefit of them adhering to it in terms of outcomes of their... All health professionals, I would put my neck on the line a little bit here to say I believe all health professionals, to their core, want the best outcomes for their patients, right? Some of their ways may be misguided, but their intentions are good. And so if we were to find the right strategies of actually getting them to understand that by adhering to these recommendations, these are the outcomes you would expect, and they will be good, right? By not adhering to them, these are the poorer outcomes you're likely to see. And not only are they bad for patients, but they're more costly for your health system. Any logical, sensible health professional would not argue with that. But it's easier said than done. Actually, the Guidelines Office is like a connector of different stakeholders, right? Clinicians, healthcare professionals, yes, but also patients. The patient voice, desperately important in terms of identifying what are the important questions that the guidelines should consider making recommendations on. These are things that patients need to be very much involved in. And in terms of how we decide in the evidence profiles whether treatment A is better than treatment B, it needs to be underpinned by a complete understanding of what are the outcomes of most importance to patients, right? And not only to patients, outcomes of most importance to all of the key stakeholders, right? And so I see the role of the guidelines, not just to produce beautiful recommendations, but actually to ensure that the recommendations are responsive to the needs of users, all of the stakeholders. So a lot of the research that I'm interested in now is also in better ways of understanding how we engage better with key stakeholders, patients. How do we engage in a non-tokenistic, meaningful way where patients feel valued, their voice are heard, they feel they're part of the process and they're part of the solutions. For me, I think that is an incredible journey that we should all commit to. The other is, of course, a thorny issue of how we in academia bridge the gap that seems to exist between us and industry. There should not be a gap. Yes, we have different end goals in some ways, but our real endpoint are the same. The same. Improving patient care. That's what industry wants to do. That's what we want to do. So there has to be ways in which we can work together to improve outcomes transparently without the perception of bias, right? And I think these are areas of work and research that I am passionate about now, because I think these are the little elephants in the room that actually, if we don't address, we don't move the agenda forward.